In this video, we will go over the exam of the trigeminal nerve, as well as the facial nerve and the vestibulocochlear nerve. For the purpose of a screening exam, we will test the sensory component of the trigeminal nerve. This consists of three divisions: the ophthalmic, known as VI, the maxillary, known as VII, and the mandibular, known as VIII. We will also be evaluating the facial nerve, cranial nerve VII, which innervates the muscles of facial expression and blinking, as well as the stapedius, which is the muscle that dampens loud noises and sensory supply to the external auditory meatus and adjacent pinna, as well as taste to the anterior 2/3 of the tongue, and the parasympathetic supply to the lacrimal glands. The vestibulocochlear nerve, cranial nerve VIII, has an auditory and vestibular component. In our screening exam, we'll be evaluating the auditory component. The vestibular function is evaluated elsewhere during gait and ocular exam. To evaluate the trigeminal nerve, we'll use light touch in all three divisions bilaterally, comparing at the forehead, cheek, and lower jaw. To test the facial nerve, we'll look at the symmetry of the face, watching for any spontaneous movements, and then ask the patient to smile and show their teeth, close their eyes tightly, raise their eyebrows, or puff out their cheeks. We want to test at least one movement of the upper half of the face as well as one movement of the lower half of the face. To test the vestibulocochlear nerve, you may rub your fingers together outside of the patient's ears, comparing each side. If hearing in one ear is reduced, perform the Rene's and Weber's tests.